that's not really accurate. So just to tee this up a little bit, give a little historical perspective, people like our panelists here have been working on these emerging technologies, especially this interface between patients and healthcare and consumers and healthcare, literally for the last 20 or 25 years. And it's been interesting as we try to apply great new technologies. We're going to hear about some technologies being developed both at the academic level and in companies, but trying to apply all these new technologies and create companies, create new industries has been a real challenge. So there have been several waves of companies, and I think one of the defining characteristics of each of these attempts to kind of bring these technologies into the commercial space has been a gradual improvement in the technologies. And the idea of actually applying these technologies in ways that are useful for both patients and physicians in the medical industry. So I will stop there and let each of our three panelists, and we're one live and two virtual, and I've asked each of them just to tee up who they are, what they're working on, and give us 4 or 5 minutes each as an introduction. And we could start with my compatriot on stage here, if you want, Alex.
Hello, everyone. My name is Alex Davis. I'm an associate professor in the Department of Engineering and Public Policy at Carnegie Mellon University. I'm co-founder and head of data analytics at Naima Health, a CMU Pitt spin-out that focuses on digital health during pregnancy. I'd like to express that I'm here representing myself. Any comments or errors are mine alone. Before I talk about my involvement in this space, I would like to address the most important determinant of health, well-being, and reproductive justice. That's economic condition. Money. The more money pregnant individuals have, the more opportunity they have to obtain high-quality health care and control their lives to reduce well-known risk factors. Economic conditions determine the quality of health care received, safe living conditions, the success of romantic and familial relationships, stress and anxiety, the ability to obtain healthy food, transportation to and from work and healthcare. Individuals with economic freedom can choose to avoid toxic workplaces, relationships, and other environments with pervasive racism and sexism. Money improves birth outcomes. The city is built on economic inequality. Every other building or street is named after a robber baron like Andrew Carnegie, who brutally exploited Pittsburgh's steelworkers, or his financiers, the Mellons. Some institutions are named after them both. The funding for this conference comes from the R.K. Mellon Foundation. In 2020, UPMC CEO Jeffrey Romoff made almost $10 million. At the same time, UPMC's overwhelmed workers, including transporters, dietary workers, housekeepers, and others, many of whom are Black and African American individuals who are pregnant or may become pregnant, do not get $10 million. They cannot pay for the health care provided by their place of work. They go into medical debt. Tomorrow, November 18, 600 Grant Street at 3 p.m., they strike for $20 per hour, elimination of their medical debt, and the ability to unionize. If you care about reproductive health and justice, you will support them. There's plenty of money in Pittsburgh. It's just not going to the people who need it most. And we wonder why those people do not have good pregnancy outcomes. If we care about pregnancy outcomes, we should support their unionization effort and their economic freedom. The technologies that we are discussing today primarily benefit the producers of the technologies, companies owned and operated by middle and upper class people or large corporations. All the money spent on this conference and R&D, I'm guessing tens of millions of dollars, would be better spent directly supporting economic justice for pregnant individuals, particularly pregnant individuals who are at highest risk. Back to me. For 5 years, I have worked with my co-founders, Professors Tamar Krishnamurti and Hayagriv Simhan, to develop a patient-facing application, My Healthy Pregnancy, and associated provider and clinician portals that provide education and risk communication to pregnant individuals, then connect those individuals to care when risks are identified. Some of the successes we've had are, one, identifying individuals who should be taking aspirin for preeclampsia prevention, who do not recognize they should be taking aspirin due to some miscommunication or missed prescription from their physician. Two, use of natural language processing and questionnaires to identify pregnant individuals at risk for depression and intimate partner violence in both cross-sectional and longitudinal studies. Three, use of non-parametric graph learning methods to create prediction models that are easy to explain and as close to causal as possible. For the creation of a Spanish language version of the application. I'd like to thank Dr. Krishnamurti, Dr. Simhan, Dr. Octavio Mesner, a former PhD student and statistician at Michigan, Dr. Kristen Allen, a former PhD student using natural language processing, and Dr. Annabelle Castillo, Samantha Rodriguez, and Leila Hayani for their excellent work at Naima Health. Thank you.
Thank you, Alex. That was interesting. And by the way, we have, I guess, well, we've debated whether everyone here, all the panelists are engineers. I guess, could I call you a social engineer? Would that be not quite right?
Technically, my training is in decision making.
Okay, decision making. And then two other, people trained in engineering. But it's interesting because we have a social perspective of somebody who does a lot of modeling. We have another engineer who we'll hear from in a moment, Wei Zhao, who is machine learning, and then Polina Segalova, who is more trained as an engineer, but I think is more in the product development, consumer medical space, and work with companies and products. So if you think about it, that's a nice kind of round sweep of this topic we're talking about and the different perspectives. So what do we hear from Polina next, who is in San Francisco?
Perfect. Hello, everyone. I'm excited to be able to join virtually. I'm a little sad that I couldn't be there in person. I actually just want to take a beat and acknowledge the statement that Alex just read. It's really powerful, and I think it hits to some of my core motivations to working in this space. And quite frankly, some of the gaps that I see in my experience in industry and what's possible versus what is actually out in the world. So I really just want to thank you for that. A little bit about myself. I am trained as an engineer, as a mechanical engineer, which I sometimes like to present as me being very focused in a certain discipline, but fundamentally mechanical engineering is an area that's so broad that it essentially lets you do whatever you want to do. And I found that really appealing as I was going through undergrad and grad school. I spent a number of years working in R&D as a traditional mechanical engineer, where I worked on medical devices and mostly surgical tools and other equipment that would go in the OR. I transitioned to working in startups. I've spent time at tiny companies. I've also spent time at bigger health tech companies. I was with Verily at a time when they had just broken out from Google Life Sciences to be specifically Verily. And I've also transitioned my role as I go through my career journey. Again, starting out with much more of an engineering background, so really understanding what kinds of things can be built for the consumer, for the clinician, for the overall ecosystem, and then really transitioning and understanding why we are building certain things. And sometimes that's how I like to explain my discipline and my role as product management, is really understanding the why. And the other reflection that I wanted to offer in terms of what I find interesting and compelling about working in health tech and in med tech is the fact that this is a space where that's so core to us as human beings. where we oftentimes are incredibly vulnerable. And me as a trained engineer who does want to find solutions to people's problems, I found it to be a really fulfilling space to work, because I feel like my skills are being used to make people better. And at the end of the day, as much as that sounds like daydreams and fairy dust, it's also incredibly motivating. And so I think if I were to venture a guess, the folks on this call and in the room can hopefully relate to some of those motivations. I'll spend just a second talking a little bit about what I'm doing right now, the company that I'm at right now. I'm currently the head of product at a small startup called Seven. We are really focused on behavioral health and really keeping the clinical efficacy that you often find in med tech or in clinical products, and bringing it much more into the consumer space. So one of the things that I've noticed as I've worked in industry over all these years is you definitely have a lot of solutions, whether it's physical devices, whether it's digital interventions, that really come from a very medical and clinical point of view. And that's really, really important, because you want to make sure that your solution is actually having an effect on the client, the user, the patient that's engaging with that solution. But on the flip side, especially being out in the Bay Area and Silicon Valley, we are just permeated with all of these incredibly user-friendly, engaging products that we, can't help but reach out to. And so one of the things that I've really been focused on quite a bit, and especially in the role that I'm in now, is how do you maintain that clinical efficacy, that engineering precision, and you bring it much more into the consumer space? How do you make it feel engaging and warm and something that you actually want to reach out and use, and doesn't feel like your mom is making you eat steamed broccoli with no butter and no salt because it's good for you. And yeah, I'm really looking forward to the dialogue in this panel, and I'm happy to hand it back over.
Thank you very much, Paulina. That was great. Great introductions. And we still need to hear from Wei. Do you want to take it away?
Sure. Hi, everyone. Sorry for not being able to make it in person. I'm Wei Gao. I'm currently an assistant professor of medical engineering. So basically, I'm a device developer. So my lab have more than 30 postdocs and PhD students. So we actually are working on mainly developing wearable sensors. So when we talk about wearables, many of you probably think about, Apple Watch, Fitbit, there are not a lot of like commercially available health monitors, right? What we are trying to really to bridge one of the gap, we think, because there are many wearables can do vital signs or physical activity monitoring, but a few products can do continuous health monitoring at the molecular level. So we are looking at, can we monitor the biomarkers from our body continuously, non-invasively, for example, glucose, hormone, drugs, metabolites, and nutrients, ions, different type of biomarker. There is no such technology right now out of CGM. Usually we need to do blood draw to do this biomarker examination, right? We need to wait some days to get some results. So as you can imagine, if we could develop a wearable platform that can real-time analyze this type of biomarker continuously, and we could collect a large set of data from our body during all these physical activities. And this large set of chemical or molecular information is not previously accessible. And if we have this type of information coupled with what we have right now, vital sign like heart rate or EKG information, we do machine learning, we can apply this large set of multimodal data for different health condition monitoring, including mental health, stress, anxiety, and also heart failure, cancers in general, many different health conditions we can work on. So basically, my lab pretty interdisciplinary. My own training history is also pretty interdisciplinary. I got my degree, mechanical engineering, chemical engineering, postdoc in electrical engineering. Right now, I'm in medical engineering. So we are building devices from chemistry, material, all the way to data. We also build a cell phone app that can collect data, save data to the cloud. Now we are also running machine learning to apply this data analysis to really enable new applications. So what we have developed, I would say we try to build this fully integrated wearable system. We try to make this, it's more like a wristband. We can wear this as more like a bandage or wristband, headband, different type of form factors. We can also, by the way, I want to make sure, what we are doing, one of the main focus is we are analyzing sweat. Because we think, sweat is a very important body fluid. We can retrieve continuously, conveniently, and non-invasively, right? Some people might argue, what if I don't have sweat? Will this wearable sensor still be useful, right? We actually have a platform that can locally stimulate and extract sweat beyond physical exercise. Even when you're asleep, I would say, we can still extract sweat and do sweat analysis. We have built sensors that can monitor, different type of metabolites, including glucose, lactate, uric acid, and we like cortisol, like stress hormone cortisol. We also can monitor different type of drugs. We have close collaborations with clinicians from multiple major medical centers, including USC Medical Center, UCLA Medical Center, Cedars-Sinai, and the City of Hope Medical Centers. In general, we are trying to apply our device technology to different health conditions. Right now, ongoing human trials, including patients with heart failure, patients with cancer, patients with COPD, and we also work on COVID tests as well. And one of the main focus also, we try to apply our multidimensional data for mental health assessment. I will stop here. I look forward to chatting with you more about exciting progress and challenges in this field.
Thank you, Wei, and very interested in the sweat work you're doing. I'm very sensitive to humidity, and I would love to understand, first of all, why. All the genetic testing I've had, I still don't really know. I mean, my father's that way. It's clearly genetic. You don't have to answer that, but that sort of just struck me. But let me just dive in to an aspect of this that I think is really, really critical, and all of you have touched on it. What is the patient experience right now vis-a-vis these technologies you're talking about, and where should we be right now? I assume all of you are interacting with physicians, the medical community. You probably have on occasion been patients yourself, people in your family. Where are we right now in terms of these emerging technologies helping with the patient experience? And I don't know, Alex, do you want to start with that?
Sure, yeah. So My Healthy Pregnancy is prescribed by the physician at the first prenatal visit, ideally. It's up to the patient about whether they want to download it. It's basically, they get a text message. They can follow that up. They'll get an email. We can follow up by phone or something like that. But so it's up to them whether they want to download and install it. And then, they can interact with it just like an app. So because of the prescription element, there's what we found is that individuals who are at higher risk we're not exactly sure what's happening, but we think that they're getting a slightly different message in the clinical environment, that you're at slightly higher risk. This is something that's going to be helpful for you, and we do find more use of the app among higher risk individuals. Use of the app is then pretty much varying between different risk groups, from something between once a month to once every couple of weeks. They use the app, and when there's risks that are triggered, individuals get, depending on the risk and whether they opt in, information is transferred to either a clinical team, a clinical provider team, or a physician team. Those physicians or clinical providers can then reach out and follow up and address issues like depression, intimate partner violence, and the other one that we've looked at is aspirin for preeclampsia.
Okay. I guess part of what I'm asking too is what has been the actual response to your app? In the medical community, is it working to improve the patient experience? I mean, it's still fairly small scale, right? And how this impacts the larger community. And I was just trying to sort of set the stage on really what the challenge is, in getting these technologies actually integrated. I don't know if you have any further thoughts on that, or we can come back.
Yeah, I mean, in the app space, there's a lot of competing technologies in like the education risk communication app space. There's a lot of competing technologies, and they have a lot of potential issues with them, right? I mean, like there's irrelevant information, some of them,
right.
Disinformation, things like that. But they have a lot of components of them that are like really fascinating, right? Like you can talk to other people, and you can buy diapers on them or things like that in anticipation. And so, one thing that we found is that, the sort of something that's more clinically focused and educationally focused is a little bit less, it's less fun, right? And you can make things, you can make it only so fun, while having it be, authoritative, as well as not propagating things like misinformation and disinformation. So that's one sort of interesting, at least from my perspective. I don't speak for anyone else. From my perspective, sort of like existing in this space where there's apps that do similar things, but it's sort of unclear from the patient's perspective, who should I be listening to, and who's going to sort of keep me engaged in sort of these multiple objectives that I have through my experience. Not all of them are just trying to get the facts.
Yeah, and I want to get to how accurate these technologies are in just a minute. But Paulina, we talked a little bit about this before, but what is the environment out there that you're operating in terms of acceptance in the medical community, or even for we'll call them patients that that these products you're developing are for?
Yeah, I have a few thoughts on this. So hang in there with me, and I'd love to hear what the rest of the panelists think about a few of the observations that I want to share now. So this is going to be a blanket overstatement. So there's a bunch of caveats that come after this one, but I oftentimes feel like the stage of our health tech is really as we're living in the 20th century, not in the 21st century. And I think there's, I had one specific example during the pandemic, which was a success story where I literally needed to get a generic prescription for like a very common kids ailment, which normally would have been like pediatrician, like in the office, and it ended up being a pretty darn streamlined messaging through the app interaction where a few texts went back and forth, and holy cow, the prescription showed up at the CVS where I could get it in a couple hours. And I highlight that story again as something that points to success. But fundamentally, we're not talking about bleeding edge technology. We're not talking about machine learning. We're literally talking about these very simple workflows that, if implemented correctly, are taking a bunch of burden off the doctor, off the patient, in the overall ecosystem. So that's the first thing I want to highlight. That in terms of wide adoptability, I still feel like we're living in the 20th century and haven't really fulfilled the promise of all the amazing health tech that we're talking about now. Which is actually a really great segue around breakthrough technologies and sort of what do we see coming up on the horizon. I love having these conversations because ultimately they end up being the North Star in what gets developed and what gets rolled out to the mass consumer market. I think the one caveat there is oftentimes what I see is a pretty big gap between what is promised in marketing materials or in commercials or in fill in the blank explanations versus what actually the product does and what happens in reality. And sometimes you have to read the fine print and that kind of brings you down, but sometimes that fine print is not even included, which I think is a huge miss. And so what ends up happening is we talk about how all these amazing technologies are being used because we see demos and apps and commercials. But at the end of the day, if you're a user using that product, you don't walk away with that experience. So I feel like part of it is just everyone being more honest and acknowledging where we are with our overall product ecosystem. And then the third thread that I kind of wanted to pull on, which I think became evident during the overall pandemic, is how we really have a tendency to copy paste physical processes into a digital world, which may not be the right solution, or may not always be the right solution. And the clearest explanation of this that I've used so far is looking at my kids' experience with remote education over the past year. And essentially, especially those of you that have kids, and especially young kids in the audience, here's what you as a parent might have experienced. You've essentially seen teachers scrambling and converting their lesson plans that are delivered in a physical classroom, trying to copy paste that into Zoom and all the tools that accompany those platforms. Where in reality, what should be happening is the focus on the specific outcome that has to happen for a student. A student has to learn how to read. A student has to learn certain concepts in geometry. A student has to learn certain aspects of history, et cetera. And there are proven ways of delivering that in a face-to-face classroom manner. But if you literally just copy that lesson plan and try to deliver on Zoom, maybe it'll work. But quite frankly, maybe you're missing out because you're using the pathway that was developed for the physical world to get to an outcome. Whereas really what you should be doing is articulating what that outcome is and using the tools at your disposal, which happen to be digital, to get there. So I think that's the other thing that I've seen in healthcare and health tech as well, is taking these developed, rooted in the physical world workflows and trying to shove them into a digital world. And sometimes there's great examples of how this works. Automation is amazing, but there's also instances where that just completely falls flat on its face.
No, I appreciate that. And I mean, yeah, we all keep coming back to Zoom, which we've been sort of trapped in, for a year and a half plus. And I wonder though if it's taking what is normally done in the physical space and translating it to digital, or the technologies should be actually allowing us to be more, able to express things from the physical universe using technology. And I want to get to the metaverse at the end here, but we were complaining actually before we started this that we're still on these flat screens after a year and a half. Why isn't there a little more interaction? Because we are three-dimensional creatures. I mean, and I think it's fair to say that telemedicine is probably one of the more significant emerging technologies that has come out, certainly in the early 21st century here, and was got a it got a jump start with the pandemic that we didn't want to enable this, but it's interesting how it hasn't really developed much beyond the basic technology that it started with a year and a half or 2 years ago. But Wei, I'd love to.
Sorry. I want to interrupt.
Yeah. By the way,
I think
feel free to jump in if you have any.
I think
comments.
the internet went out. I don't think this is being projected live.
Oh.
I apologize for interrupting. So it says network error here. Yeah.
I can still hear you guys for what it's worth.
Seems normal here.
Is okay. So other people are still on. Yeah, we did have an error message pop up on the screen. Okay.
Thank you.
Thanks. Anyway, Wei, so I looked at your lab page, and it's quite extraordinary, all of the things that you're working on, devices you're developing, and including some invasive, like nanobots, You had one of my favorite movies, which is Fantastic Voyage, from the 60s. There's actually a little picture of their ship. And if you don't know that movie, there's somebody dying and they have to go and fix him. And so they shrink people down into a little submarine and they send him through the body. We don't quite have that emerging technology yet, but some of the nanobots might be able to do that. But maybe we could pull back for a minute as we're discussing some of these issues around emerging technologies. I think you would be a perfect person to kind of tell us maybe where we are with the technologies and maybe tick off a few. You did in your opening remarks, but where we are and where you think we should be.
Mm-hmm. Yeah, because as I mentioned earlier, we are like hardware developers. So right now, as all the panelists mentioned, like telemedicine, COVID-19 actually it's a great opportunity for telemedicine, right? Like now, no matter for user, consumer, or insurance companies, they are open in general to wearable devices. Yeah. So I think from technology development point of view, the future direction is really shifting the healthcare to home, right? We want to do at-home health monitoring, no matter from software side and or hardware side. We try to bridge the gap by developing hardware, even including the metaverse we talk about later. We need the hardware to collect information, to get the data. So from our point of view, to really, right, previously all the healthcare, people have to visit clinic to do blood draw, people wait time to get a response. And for the future healthcare, everybody talk about the personalized medicine, precision medicine, right? Like ideally, we want to tailor all this therapy or monitor according to each person. So in this regard, we think, like sensors, wearable devices will play an important role. Of course, we have a lot of challenges right now. So we talk about the user experience, and we see that we also do a survey when we recruit the patients. Let's say heart failure patient or cancer patient, we get a very high rate. For even all the inpatients, over 75 or 80% of patients said yes, they're really excited about technology. They want to be involved in a study also. They want the technology, but the technology is not there. We demonstrate a lot of proof of concept already, mostly either in the inpatient setting or in the laboratory setting. They always a lot of potential collaborators, the public health expert asking me, can you give us like 20 or 10,000 or even 1 million units? I can recruit people to do this study. We want to make sure the device we build are robust and can be used by people, right? This of course require technology development advances and a certain also commercialization. So together, I think we require a lot of from chemistry material. We do the pilot study and some either we do a partnership with big company or we do our own startup. We also open all these different directions. I think many other professors the same. Big companies are also doing the same. I think it requires together technology innovation plus successful commercialization pace. We can make more and more wearable sensors to be available. And people talk about the future vision like 1 trillion sensors, right? Everybody can wear a silent sensor at the same time. Of course, there's another topic related to data health, privacy. But together, the vision is really, we have enough reliable device that allow us to collect all dimensional data. And really, we can enable personalized healthcare. That's the future, we think.
Yeah, and by the way, that's a very important point because, being somebody that has this 20-year perspective on all of this, I used to give talks about how, the technology wasn't just there. It just wasn't there. And in some cases, the data was being measured in some way, heart rate or Fitbits with steps, which by the way, 10,000 steps was totally made up, which is, one of the issues with a lot of these technologies where there was just some arbitrary, set of metrics were imposed. But I think more and more, I see if you all agree with this, the technology is actually getting accurate. And people like you, the three of you and many others have really worked very hard to try to not make these metrics arbitrary, but actually have some basis. Because it's a matter of the hardware, it's a matter of having the data and the databases, and then a matter of being able to make sense of all of that through machine learning and computing power. So I really appreciate that overview. In fact, I wonder, I want to ask you all, and maybe I'll turn back to Alex, is technology the issue in making this happen in a more effective way in healthcare, or are there other factors?
Why don't we let one of the online folks start here, just
Okay,
so we
that's
can
fine.
mix it up a bit, yeah.
Anybody want to, I mean, in other words, technology used to be the problem. Is there an issue now? Are there other issues now? We talked about this a little bit, some of the social issues, et cetera. But what is the biggest challenge for you all? All three of you are involved with companies. What is the biggest challenge for you?
I can jump in. I don't know if there's lots of big challenges, first of all, but one that might fit in line with this conversation, one that I've spent some time thinking about, is people's expectation around how and how much they pay for healthcare. So fundamentally, because of the way that the majority of healthcare is structured in the US, you pay a premium, you hopefully have health insurance, but it's not something that you are used to paying in the same way that you would pay for a gym membership. So I think there's a fundamental reluctance, understandably so, from the consumer to pay for anything that's like health related because they have health coverage. That being said, the way that health coverage works is it oftentimes treats the symptom, not necessarily the cause. And if you think about disease progression as someone ages, a lot of our healthcare spending is really at the end stage or when people are really, really sick and not necessarily upstream to where that trajectory can be diverted or maybe even prevented. So again, like one of the tough nuts to crack is around how do you find that sweet spot and how do you actually get people to care enough to invest? Or structurally, is there a way to plug into the current healthcare system that really incentivizes some of this upfront preventative cost and not necessarily, I'm so sick that I'm in the ER and therefore this is like the giant bill that comes out of it.
Yeah, I was thinking partly policy. We're going to be talking tomorrow a little bit about, in another panel, about preventive genomics. And that's an area I've been working on for 20 years. And you would think I would think it would be farther along by now in terms of actual applications and even the science. And it has run up against, it's more structural problems, policy, some other issues around like how doctors are educated and the healthcare system. But a lot of it does fall on incentives. And like you say, there are disincentives in many ways to embracing these new technologies. When you have really ingrained systems. We won't talk too much about Epic and some of these, the electronic medical record systems, but I don't know, every doctor I talk to, that word is mentioned, Epic, or some of the, I shouldn't pick on one company, but there's still, it's very...
Go ahead.
Yeah, well, whatever, I'm a journalist. Trying to introduce new technologies, data streams, metrics into these established systems is just one very big, interesting issue. And by the way, we are, believe it or not, we've only got a few more minutes here. I did want to make sure that if anybody here has a question, why don't you guys walk up to the microphone.
Thank you.
And
Thank you
we'll
for
take
the
this question
invitation.
Here. And tell us who you are.
My name's Helena Zazinski, and I'm a reconstructive pelvic surgeon, a urogynecologist. So I take care of women who actually 20, 30 years down the line are experiencing the sequelae of nerve and muscle injury from childbirth. So my homies, my crowd, are in their 70s, 80s, and 90s. And what I was waiting for was to hear about how all of you are considering that other hurdle, nearly half of the population, which is struggling. They have smartphones. We try and do telehealth visits, but they don't buy the data plan because all they need to do is dial their daughter or their granddaughter or 911. So They don't have any video or FaceTime. And yet some of them in their 80s, during the pandemic, when they're on blood thinners, got these little gadgets at home and could actually get their INRs tested so that they didn't get over or under medicated, and they adopted that so well. So some of these devices are incredibly easy to adapt or adopt to, but so many others are impossible for them to grasp. I mean, I'm trying to get women to remember to go to the bathroom every 3 hours to empty their bladders so they're not incontinent because of early dementia or loss of sensation. How are you managing those hurdles? Because it's a lot of people out there.
It's a really good question. I mean, I bought my father 3 different smartphones, and occasionally I'm shocked and I get a picture, but I find out somebody else sent it through his phone. So he's 90 years old. But how do we deal? You all are, we're talking about this sort of high-tech future, but how do we integrate this into the here and now, especially for that half of the population that, a lot of these baseline technologies, Zoom, forget it with my dad, unless somebody else is helping. How do we reach that patient group?
Yeah, I have a couple of observations, and thank you so much for bringing that up. My first observation ties back to an earlier statement that I made about the gap in marketing versus what's actually out there. I often feel, and again, being out in Silicon Valley, that the thing that people most talk about is like the cool, sexy, like shiny thing. And it's not about like the bulk of problems, which are probably not sexy and not shiny, but like, holy cow, are really core and need to be solved. So number one, just acknowledging like where, how we talk about things and where the focus for certain solutions is. The other thing that I want to talk about is some of my favorite disciplines to work with, and specifically that's design and research. I have seen, I would say over the last 3, maybe 5 years, a genuine interest and focus from companies on accessibility, on doing upfront research. And by research, I mean user research, actually going out and talking to people that are going to be using the technologies to actually design solutions that fit their lives. And again, these are not revolutionary methodologies to use by any means, but a lot of times they're not. Again, there's been an uptake, and I think it'll take a while for that trickle to really become a wave and to wash over the industry. But listen, we have an aging population. We absolutely need to take accessibility and technology adoption into account.
Yeah, absolutely. And maybe someday we'll have passive wearables, that allow us to do that the way we'll design. So, my father will just have these somewhere in his clothing or something, and he doesn't have to worry about it. Anyway, another question?
Yes, hi everyone. I'm Idalis Flores. I'm not a medical doctor. I'm a researcher. I study endometriosis. It's a painful disease that affects young women. So in my case, my population would probably have no problem using that technology. And I cannot tell you how excited I am to hear about what you're doing and how it could impact the research. So I'm talking now as a researcher. I can tell you that we are working with the development of an app for getting data, longitudinal, real-time data, but we've also like to study biomarkers. For example, when you mentioned cortisol, we're like, oh my God, if there will be a passive way to get not only the data through an app, and I would like to hear a lot about how to keep engagement active, because that's a challenge. So that's a question for Alex. For Wei, how close are we to be able to monitor things like cortisol or hormones, estrogen, estradiol, progesterone, that we can then correlate with the data that we're getting And to Paulina, I think you mentioned digital health and digital interactions, things like maybe chatbot that will help maintain active communication with the user, and perhaps that would be the way to actually maintain this engagement. I mean, my mind is just, I have so many ideas, and I'm just so excited to hear about how close we are to having this really work, not only for the medical, practitioners, but for research. We need all this data on all these biomarkers.
Yeah, no, I really appreciate that, and that world is getting closer. As I said, it's so interesting how the commercialization process of almost any product, and I followed several of them. There has to be wave after wave, hitting the shore, trying to break down that sandcastle that's resistant to it. And I think we're getting closer and closer to that. But we are at 6 o'clock, so maybe we should probably wind this down. Does anybody have any burning thought? Especially, I did want to ask if you can maybe give me 1 or 2 lines. What emerging technologies for individual patients, consumers, imagine yourself 10 years from now, in 2031. What would that look like, Wei, for you? Just in 3 or 4 lines.
Yeah, I think the technology evolves. We really want to develop the important biomarker and to be able to monitor this continuously, conveniently, including as the audience asked, the cortisols, female sex hormones. Our goal is really conveniently, continuously, and non-invasively monitor this, make user feel comfortable, or even passive monitoring. They don't have to do any type of extra operation or automatic. And the physician or the user could get the real-time feedback. That's our goal.
So my dad will be 100, and that'll be perfect for him in 10 years. Alex, do you have any?
I guess just from
I
my
don't know
perspective.
if we lost Paulina here, but anyway.
Yeah, from my perspective, technology that effectively can connect people to real-world resources, right? Whether that's financial resources, whether that's clinical resources, whether that's social work or other sorts of resources, and those resources have to be good, right? So I don't think anyone's really done that, and because both the technology side and the existing world side are not there. Hopefully we get there in 10 years.
Good. Okay. Well, listen, I appreciate it. We did seem to lose Paulina. I hope she isn't lost out there in emerging technologies space somewhere. We can't bring her back because we haven't invented the metaverse yet. But anyway, thank you all. And I think at least Alex will still be here. I'll still be here. I'm sure that Wei and Paulina, if you contact them with more questions, would be happy to answer them. So thank you all, and thank you all for coming.
Thank you.
Thank you, everyone.
Thanks, Wei. Enjoy the sun.
Now here you go again. You say you want your freedom. Well, who am I to keep you down? It's only right that you should play the way you feel it. But listen carefully to the sound of your loneliness, like a heartbeat drives you mad. In the stillness of remembering what you had and what you lost and what you had and what you lost. Thunder only happens when it's raining. Players only love you when they're playing. Women, they will call and they will go. crystal vision. I keep my visions to myself. It's only me who wants to wrap around your dream. And have you any dreams you'd like to sell? Dreams of loneliness, like a heartbeat drives you mad. And the stillness of remembering what you had and what you lost and what you had and what you lost. Thunder only happens when it's raining. Players only love you when they're playing. Say women, they will come and they will go. Yeah. When the rain washes you clean, you will know. You will know. When the night has come and the land is dark and the moon is the only light we'll see. No, I won't be afraid. No, I'm a ghost living in a ghost town. I'm a ghost living in a ghost town. You can search for me. I had to go underground. Was this